Now, new research has provided some insight into why some people could be suffering from long COVID. A UK-based study found people who are hospitalised with the virus are 3 times more likely to show damage to organs, including the lungs, brain and kidneys. Well, joining me now is Ondine Sherwood, co-founder of the charity Long COVID SOS. Very good afternoon to you, Ondine. So,
thanks for having me.
Can you tell us more about this study? What's it going to show us about people with long COVID?
Well, this study is a very long-standing study that was first set up in 2020 in people who are hospitalised with COVID. So these are people who've had relatively severe disease. And we've known for quite some time that COVID causes organ damage. This particular study is, as I said, only in hospitalised patients, which is a relatively small proportion of the total number of people with long COVID. But it was one of the first studies looking at ongoing impacts from COVID-19. Yes, it's showing about 1/3 of people who are hospitalised have damage, particularly to the lungs, brain, which is very worrying, and the kidneys. And I suppose it shows that COVID is not just a cold, but what it doesn't show is what's happening to the people who weren't hospitalised. And there are many, many more people who were never in hospital, but are still suffering from the impacts of COVID. There was a study in 2021 published using MRI scans from spectrum cover scan, and researchers from various universities, which showed a high level of organ damage. And of that, only 20% had been hospitalised, and the average age was younger, and they had fewer comorbidities. So what we really need is much more research in people who weren't in hospital, because there are so many people still suffering, and many of whom are finding it very difficult to get any treatment.
I mean, I must admit, Ondine, I am someone with long COVID. It's something that's completely changed my life, but with studies like this, it's difficult for people when you hear very medical, quite scary sounding statistics. But as you say, many people weren't hospitalised in the first place. I mean, do you think that studies like this, do you think that they are worrying, or do you think that they give hope to people with long COVID?
Well, I've been thinking about this idea of giving hope, and I'm struggling. I think it gives hope that the condition will be, or should be, more recognised, that people won't be dismissed when they present with their symptoms. I think it gives hope to people like me that the public will take it more seriously and not assume that getting COVID is a walk in the park. Because the fact is that people of all ages can have ongoing symptoms, people without comorbidities. And there's no way of knowing at the moment. Yes, we might have some data on who's more likely to have ongoing symptoms after an infection, but it doesn't rule people out. And people of all ages, people who are really fit, people who may have been less fit, can go on to have symptoms ongoing for months, years, very disabling in some cases. And yet, COVID is seen as something we're living with and not something we should worry too much about. And this really isn't the truth. The inquiry, Module 2 of the inquiry, is starting in a couple of weeks, in less actually. And I really hope, we're part of the inquiry, and we really hope that we're going to find out why this information about COVID, this really important information that it's not just deaths and hospitalizations. People can be made sick and really lose their lives for long periods of time, unable to work. That information is not out there, which means that the people who are just being exposed, they don't really understand their risk because they're not being informed.
As you say, you're going to be contributing to the inquiry. What kind of support would you like to see brought out for people with long COVID off the back of this?
Well, I think we're still working on recognition. Our charity was formed, 3 pillars: recognition, research and rehabilitation. We're still having to work on recognition. What I would like to see is for the government to acknowledge that this is a very important part of the pandemic, which is ongoing. As we know, there are fears now for higher rates this autumn and variants of unknown quantity, really. And what we need is for there to be much more information out there so that people understand their risk, so that people can think about ventilation, people can think about whether they should be wearing masks in unventilated, crowded places. We don't want to see more and more people getting long COVID because there's no treatment. So at the moment, people are being supported. There can be treatment for certain symptoms. If you have organ damage, it's more likely, if you have organ damage and it's detected, it's more likely that you will get some help from the NHS. But many people are walking around with organ damage which hasn't been detected because they haven't had the right tests. So what we need is a better acknowledgement that long COVID exists. It is not in people's heads, and we need much, much more research. There hasn't been any research, government research, anything significant since 2021. The government talk about 50 million, but that was way back, and it's really hard to get long COVID studies funded at the moment. There's one brilliant study going on at the moment, Stimulate ICP, which we're part of, looking at repurposed therapeutics, but there's very little else going on to help people get better and to look at the mechanisms and look at ways of treating it. So we really do need a lot more recognition.
I mean, I'm relatively lucky. Well, I am very lucky that I'm part of a kind of treatment centre. I'm very lucky to kind of have the support that I've got, but I know that it's a postcode lottery as to why I'm part of the treatment group that I am. There are millions of people across the country living with long COVID who don't have that level of support. What advice would you give to them?
They need to go to their GPs, and if their GPs don't really understand what long COVID is, they need to probably help their GPs to learn more about it and get referrals to a long COVID clinic. If you're living in England, there are 90 or more long COVID clinics. They do vary, unfortunately. One of the problems is the variability. We have excellent clinics, and maybe that's what you're part of, but there are many which are really not good enough and don't have enough medical presence. But people really must, if they can, is to try and get help, whatever help they can, and to keep informed and to tell other people about their situation, particularly at work, so that their employers can be more accommodating if they can work. And of course, we know many, many people with long COVID can't work. It's very difficult. People with long COVID have literally had to advocate for themselves for years. And it's extremely tiring. It's exhausting. If you're suffering from fatigue and ongoing debilitating symptoms, to have to fight for your care. I mean, it really is demoralising. And you may have had a little bit of that before you were lucky enough to get into this situation where you're getting some decent care.
I did, and I am very lucky to be part of the clinic that I am part of. But as you say, it's an uphill battle. But I really appreciate your time this afternoon. Thank you very much, Undine Sherwood.
Thank you very much for having me.
Co-founder of the charity Long COVID SOS. This new research providing some insight into why people could be suffering from this condition. People who are hospitalised with the virus now 3 times more likely to show damage to organs, including the lungs, brain and kidneys. But as Undine and I were just discussing there, not everyone was hospitalised. Millions of people up and down the country still suffering the impact of long COVID. We're going to